So ADHD is a condition which incorporates difficulties with attention, impulsivity and hyperactivity. And it's generally first evident in childhood, so the diagnostic criteria suggests that you need symptoms prior to 12 years of age. And those symptoms need to be associated with functional impairment, so there's the symptoms are getting in the way of social functioning or functioning at school or at work, those kind of things. And the symptoms shouldn't be better accounted for by other conditions that can look like ADHD. So inattention's a very common symptom in lots of different mental health conditions, and you need to make sure it's ADHD rather than anxiety, for instance, that's causing it. The other things about ADHD, it's strongly heritable, so it runs in families frequently. We think about 75% of the likelihood of having ADHD is due to genetic factors. So ADHD, as I said before, is strongly genetic. 75% of the chances of you having ADHD are genetic in the origin, but there are a small number of other things that can raise the likelihood of ADHD, and they tend to be things that are present early in your development. So some substances during pregnancy are unhelpful for the developing fetus, alcohol being kind of number one. So fetal alcohol syndrome or fetal alcohol spectrum condition frequently involves ADHD type symptoms and executive functioning difficulties. But there's some discussion of organophosphates and sodium valproate and some other substances that are unhelpful. And then premature birth and having a very low birth weight, things that increase the likelihood that you may have ADHD. If you have hypoxia at birth, cord around your neck for too long, 3 minutes or longer, that can increase the chances of attentional issues later on in life. And then head injuries is another thing that can increase the likelihood. We tend not to think that the general range of parenting's involved in causing ADHD, but some people with very significant early trauma can be much more likely to have ADHD than people without very significant early trauma. It seems to change the brain structure and function.